Good morning, everyone. This is Marcy Nielsen. I'm the Chief Executive Officer at the Patient-Centered Primary Care Collaborative, and I would like to welcome you to our phone call today. This is our quarterly open forum call for the Advocacy and Public Policy Center. So thank you for being here, and happy Valentine's Day. Our goal is for this call to introduce you to our center. We've done that in the past, but we're going to do that with some specificity today. We're going to introduce you to the leadership of our center, and then we're going to be soliciting your feedback about the many strategies and objectives that we've identified for 2013 and into future years. It's going to be important as we move forward that we take the long list of activities that we might possibly engage in and ultimately prioritize those. So part of what we're doing today is to get your feedback and understand what you think those priorities are. As many of you know, each of our centers had a leadership retreat in the month of January where the leadership from each center defined their own goals and objectives. And the goal of this call is to bring the public in. We're wanting you to weigh in, and we're very excited and eager to get your thoughts and learn what your opinions are. I just wanted to remind you all that these calls are going to be held quarterly, and that we anticipate our next round of calls will happen in June. And at that point, you'll be able to see the final plan for the next few months and an outline of the deliverables that you can expect from each of the centers. And those deliverables include things like publications and events, white papers, etc. So lots to talk about today, and I think we'll go ahead and begin. So we are moving on to slide number 2. In slide number 2, you will see that today's agenda includes an overview of all of the stakeholder centers briefly, as well as their role within the PCC, an overview of the center communications, and then I'm going to hand this call over to our center co-chairs, Sherry Erickson from the American College of Physicians and Greg Paulson of Stevens and Lee. What they'll be doing is leading a discussion about the specific goals and objectives that the center has drafted. And then they're going to lead you through a facilitated discussion to get your feedback and your guidance. Again, remembering we won't be able to do everything, so what priorities do you all want to see come out of this work? Before we begin, I wanted to give a quick overview for audience participation and tell you a little bit more about how the feedback that you give us is going to be used in the future, and then provide you with a brief overview of the technology and let you know how you can participate. It is really important to us that folks are active on the call. We'll be doing some polling questions. Again, with the data that you give us today, we'll be feeding back to the board and to the center leaders what your thoughts and ideas are. Once we've collected your votes, we will bring this information back to the cabinets themselves. Information will be used to help narrow down the list of things we work on for the year. And again, we take the polling questions quite seriously, so if you could be very, very thoughtful and mindful of that when you're ranking specific goals and objectives, it would be terrific. For those of you who are not familiar with this technology, this is our second call, and so we're still ironing out a few of the kinks. But when we get to the portion of this call that is the Q&A, you're going to need to enter in the audio pin, and that's located on the webinar dashboard, and Lauren will remind you about this. We'll be letting folks answer polling questions that pop up on your screen, and we'll be giving you a few moments to cast your vote. And then we're going to open up the lines after each poll in order to discuss the results. And at the end, at the end of the presentation, open it up to everyone for an opportunity to dialogue. When we're ready for that part of the call, you can get in the line or the queue for questions in one of two ways. You can, quote unquote, raise your hand. There's a raise your hand function which will allow us to see that you've got a question, and we will unmute your line. Or you can actually type in a question into the chat function, which will be presented to us on the call, and we'll read your question and share our answers. So with that, moving on to slide number 3 and a quick description of the PCPCC itself and the center work. So as I think most of you know, the PCPCC has 5 stakeholder centers. They've been reorganized and restructured since the fall of 2012. And you'll see here in a moment what those 5 centers are. We've got an org chart to show you. This call today is pertinent to the Advocacy and Public Policy Center, but we've also got Care Delivery and Integration, Employer Purchaser, Outcomes and Evaluation, as well as Patient, Families, and Consumers. The stakeholder centers are essentially responsible for being the incubators and drivers of our core activities and programs. They are set up to achieve the goals that the board has initially outlined and that you all as centers have had feedback on, and certainly the center cabinet, which serves as the leadership for each of the centers, typically about 10 to 20 folks. Those folks who participate in the cabinet limited to our executive committee members, and I think many of you are aware the EC members of the dues-paying segment of our membership. We also have some other invited thought leaders when in fact we've identified some gaps in content expertise. The cabinets are meeting on a monthly basis. So while these public open forum calls are quarterly, and I should just point out there may in fact be members of the press that join us on the call, the cabinet meetings are monthly, and their mission is to focus on the goals as they've been prioritized, and then what work has been done to date. For general questions about these centers and the way things are organized, I do want you to contact Tara Hacker. Tara is the Director of Programs here at the PCPCC. She's on the phone with us, and she's very easily accessible by email. Her contact information is going to be included on the last slide. Okay, moving on to center communications, which is slide number 4. I want to tell you a little bit about how we communicate with the centers. First and foremost, what you will note is that we've got a dedicated web page for each of the centers. You can access those dedicated web pages from our home page, which is pcpcc.net, and we're showing this to you here in the slides. But in the next couple of months, we will be launching a brand new website. So the website you have in front of you has been significantly retooled over the course of the year. The new website is going to look and feel quite a bit different and will have much more robust content. It's going to include resource libraries dedicated to the center's topic, lots of easy-to-access meeting materials, news updates, etc. Another way we communicate with our centers and the folks who are members of our centers is through a monthly newsletter. We've been sending it out separately, these newsletters, to each center, but wanted to let you know starting in February, we're going to consolidate the information that previously went out to each separate center into a single newsletter. And that way, you'll be aware of what all the other centers are doing, and we're not flooding your inboxes. Many of you subscribe to multiple centers, and so getting all your information in one place will probably be useful. Another way in which we communicate with folks is via webinars. And so the monthly updates are going to include information about our webinars. These webinars are developed and sponsored by the centers, and the plan is to offer two webinars a month. And just a reminder, you can subscribe to the Center Monthly Update through the center web pages. But we hope that you also choose to receive your news about the PCPCC through our social media networks. We're pretty active on Facebook and Twitter, and so would love to have you get signed up there. Moving on to slide number 5. I've mentioned that we were going to share with you our org chart just so that you can see how the work of the centers, which is here in green, dovetails with the work of the board, outlined in gray, and where the executive committee, our dues-paying members, sort of exist on the org chart. And then also to remind you, we've got task forces and special interest groups, event planning, publications that are sort of cross centers. Moving on to slide number 6, and without further ado, it's my pleasure to introduce to you two fabulous center co-chairs who have had a long history with the PCPCC. First, Sherry Erickson, the Vice President of Government and Regulatory Affairs at the American College of Physicians, and Greg Paulson, who's a Senior Medical Analyst at Stevens & Lee. He was most recently with Blue Cross Blue Shield Association, served for a long time with NCQA, and is one of the all-around PCPCC good guys, as is Sherry, a good gal. So without further ado, I'm going to hand this over to Greg to move on to slide number 7. Greg, are you there?
Yeah, I feel like maybe he may be having an audio issue. If Sherry, if you could maybe take it, we can figure out what's going on.
Hi, this is Sherry. Would you like me to go ahead and try to start the polling questions then?
Oh,
Greg, you're on.
Oh, there's Greg.
Yeah,
okay. As I said, welcome everybody, and thanks very much for joining us today. This is your chance to give us some input. And what we're going to do is just do a couple of quick questions first, and then Sherry's going to talk about the leadership retreat, and then we're going to come back and do some more polling to get your rankings of the various areas that the leadership group designated as possible sort of prime time activities. So the first set of things is just to get a little idea of who's on the phone and what your backgrounds are. So the first poll is about what your current role is in your organization. And so you can see on the screen we've got government affairs and relations, consumer patient advocate, patient primary care clinician, government employee or official, work for a nonprofit professional or trade association, or work in private industry or health plan. So if you can just quickly check that, we'll get your combined input in just a second or two after you vote. So go ahead and vote right now. Okay, and so what you can see is that, interestingly, most of us work for a nonprofit professional or trade organization. We've got a few primary care clinicians, and some are from private industry and health plan. And this is a nice mix across different areas, including working in government affairs. So the next thing is we're going to ask you a little bit about why or what the primary reasons that you chose to participate in this call. And they're listed on the next PowerPoint. So if you can vote right now on these, that would be very helpful. Okay, well, it looks like most of you are looking and wanting to learn about strategies that use the PCMH model in health reform. And obviously, that's a really important overall area for all of us. And one of the things about the centers is they're really two-way streets, at least as Sherry and I have envisioned the Public Policy and Advocacy Center, because we're not only gathering your ideas for input and pushing on to public policy makers or policymakers in general, but we're also looking for your organizations and trying to align the message that all of us are trying to use in making more apparent the values and benefits of the patient-centered medical home in both the public and private sectors. You can see there's a nice scattering of the interest in other areas in terms of the federal state programs and policy experts. So with that, we're going to turn now, and I'm going to flip it back to Sherry, and she's going to talk a little bit about the areas that we talked about at the leadership retreat and a little more in depth about our particular Center of Public Policy and Advocacy. Sherry?
Great, thanks, Greg. And thanks, everybody, for participating in the polls. We really appreciate it. These first questions are really just to give us a sense as to who's on the line, and then we'll be asking some questions coming up that I think will help us and feed back to the center leadership and to the board in terms of setting our priorities for going forward. As you'll see soon, there are a lot of different things that we're considering in terms of tactics moving forward, and we certainly won't be able to do all of them. So we want to be sure we get everybody's input as we move forward so that we try to set our priorities in a way that makes sense for a large portion of the membership. So with that, I'm going to talk a little bit about our center. The center serves as really the public-facing group to educate multiple audiences about the patient-centered medical home. We're going to work to guide policymakers, agencies, and government leaders on incorporating medical home features into the health system reform. We want to help shape the PCPCC policy and advocacy agenda and ideally align stakeholders to support meaningful policies on a number of issues, including accountable care organizations, insurance exchanges, information technology, and payment reform. It's a pretty broad set of issues, but there really are, I think, a lot of areas where we'll overlap across multiple stakeholders and find sort of those key niches within those that we are the most important for the PCPCC to focus our efforts on. And that's part of why we want to get your feedback through this call and moving forward as well. So next slide, please. I'm not seeing the next one pop up. The leadership slide. Thank you. So to accomplish this work, we have representation from a diverse range of stakeholders that you can see here. We wanted to give you a quick look at our leadership cabinet so you can get a sense, and you should feel free to outreach to Greg or myself or really any of the leaders involved in the cabinet here, as they're the ones that are going to be participating on these monthly calls that Marcy mentioned going forward. Next slide, please. So the strategic objectives, we have 3 of them that we're going to be seeking your input on going in terms of the tactics to approach these objectives. And they're listed here: to advocate and inform the development of public policy to drive health system reform. Second one is to promote primary care in the PCMH as part of federal and state health care programs, and we have some listed here. And to gather and communicate evidence that demonstrates the medical home impact on the triple aim, which is, as you all likely are aware, is better health, better care, and lower costs. So those are the main objectives that we're going to be speaking about today and providing you some tactic options that we're going to look for your feedback on. Next slide, please. Thank you. Oh, you guys are fast now. Okay, so in terms of the, we held I think, as Marcy mentioned, we held a leadership retreat in January, and we developed some tactics around each of these strategic objectives, and they're listed here. I'll just run through them briefly, and then also Greg will run through them again because I know for our polling feature, we have somewhat of a character limit, so you may not be able to see every single word of these on the poll, but so that's why we're going to run through them with you to be sure that you know what's on the list and what we'll be seeking your feedback on. So there are a lot of tactics listed here, as you'll see, and there may be some lumping that we can do within here, but we wanted to kind of keep them laid out this way to get your input. One of the ideas was to develop a publication on medical home value and return on investment related to health system transformation, building on what you've probably seen before as the evidence document that was recently released by the PCPCC, or maybe a few months ago. We want to develop recommendations on best practices of payer models that advance medical home for states. We are interested in identifying effective ways for using health information technology in a medical home. We also want to develop communication tools to enhance public awareness of the medical home, and perhaps also develop a publication with the results of a proposed employer summit targeting policymakers. And that, I know we haven't really spoken that much about before, and some of you may be very aware of this, and some of you may not be aware of it at all. So I'll just give a brief summary. And that is, back when the PCPCC was originally formed, we had a core set of employers who were engaged at that time, and they were certainly interested in this moving forward, but were interested in more detail. And so since then, there's been a lot of work that's gone on, obviously. The joint principles were developed, and we've developed a lot of policy. There have been a whole lot of pilot projects that are really rolling out now and are beyond pilots at this point. So there's a whole lot more that we could share with a broader employer audience than what we could share several years ago. So there's a significant interest in pulling a large group of employers together to have a summit and let them know what we've been doing to date. and that things have progressed significantly since they have heard about this maybe several years ago. And this will be really a cross-center activity and will involve obviously the employer center, but likely some of the other centers as well. So this is one of those things, looking back at that, at the org chart that Marcy shared, it would be really probably a task force to take this on that would involve individuals from a number of the centers. So one of the things the Advocacy Center is looking to do to assist with this project would be to develop a publication that would speak to the results and some of the feedback that we heard from the employers at that summit. And finally, we're interested in compiling the cost and quality data and being able to communicate that to policymakers. That's quite effective. Other advocacy organizations and the general public. And that data may end up falling into the publication that's mentioned in the first bullet, of course, but so there's certainly some lumping that could be done within these. But again, we wanted to sort of share a broad list with you all to get your feedback and what you feel are the top priorities for the organization to take on to address this strategic objective going forward. So with that, I'm going to turn it over to Greg to facilitate our polling.
Okay, so we're going to go through and get your input on this first set of questions. And you can be voting while I'm sort of talking and providing the full question, because as we noted, we couldn't get all the statements on each of these on the screen. So as I'm talking, you can go ahead and start voting, and by the time I'm done talking, we'll be ready to look at the results. So the first is to develop or modify and enhance the publication on medical home value and return on investment related to health system transformation. The second is develop recommendations on best practices of payer models that advance medical home for states. The third is identify effective ways for using health information technology in a medical home. The next is develop communication tools that enhance public awareness of the medical home. The next is develop publication with results from the proposed employer summit targeting policymakers. And finally, it's compile cost and quality data and communicate to policymakers, advocates, and the general public. So please vote on those. And you're great. You follow directions exactly. You can see that we're pretty evenly balanced between the publication, the developed communications to enhance public awareness, which obviously is an expanded version of that first one, and then communicate cost and quality to policymakers and the public. So in a sense, these three responses fit together very nicely, and I can see this nicely tying into a task force project that maybe goes across centers, as Sherry suggested, and touches on using these three main pillars of developing a publication, developing other communication pieces, and really communicating this cost and quality data to policymakers and the public. Any questions, comments, or thoughts about this particular set of priorities? Are there other suggestions that are sort of missing that some of you felt that this wasn't as complete as it should be? Or do any of you have thoughts or suggestions about how we might best approach this major communication task? And you can either raise your hand or indicate that you're coming on to the audio portion.
David Pollack, I am unmuting you to speak.
Hi.
Hi, David.
David Pollack.
Go ahead if there's any questions or comments.
Well, I'm just concerned. I sent in a longer statement that relates to the need to focus on workforce.
Could you, at least I'm not able to hear whoever's talking.
Yeah, you could talk more into your mic, David. We can barely hear you.
Ted, I'm concerned about there being more information on objectives that relate to workforce development. I wrote a longer statement that you could read. I don't have to repeat it now.
Okay. Okay, very helpful. And obviously a lot of us are concerned about the workforce issues area across the board. Anyone else? Okay, Sherry, back to you.
Okay, I wanted to ask Marcy if she had anything to add related to workforce development. I know it has been part of conversations at a number of these meetings, so I just wanted to see if Marcy wanted to chime in on that front before we move forward, or if you want to go towards the end and then we can address some of these at the end.
Oh, thanks a lot, Sherry. Yeah, I would have to. I have the echo here. Can you guys hear me all right?
Yep.
Okay, terrific. So we do have an education and training task force that is actively soliciting information from various interprofessional health professions organizations, whether it's a residency, a program, a pharmacy program, social work program, etc., looking for examples of how we're training health profession students to offer care that is consistent with a patient-centered medical home. We've got a place on our website now. If you look to the PCPCC website, there's a place under task forces for education and training. What we plan to do with that data, and we're hoping to get lots and lots of submissions, is to make it available probably through some sort of table within the website itself, but also turn that into a publication, and it may be multiple publications depending on what we get. We're looking for best practices to get the word out about how to train students. Obviously, that's for current students who are health professions. Lots of work to be done for current professionals who are already providing clinical care and how we train them. There you've got the numerous transformation organizations and technical assistance organizations, but I think there is a real sense of focus and concern as well as energy around how we're going to ensure that we've got the workforce of the future all teed up and trained to provide the care that we are advocating for today. So it's a great question, David, and one that we are certainly rolling up our sleeves and getting busy working on.
Yeah,
and thanks for the opportunity.
Just a quick comment. I think that really also illustrates very nicely that these centers are sort of hubs and spokes that interact or interdigitate with each other, and perhaps gears that interdigitate with each other, because these ideas are sort of popping in different places and then they're flowing to the different centers. And I was just looking at the sort of spectrum of leadership retreat outcomes across all the centers, and there's a huge number of very common themes that come out there. So, and I think the public policy advocacy group is really critical to being a very key push point in and out of these different kinds of projects and different sort of viewpoints on the different projects. So that obviously there's workforce from within the educational institutions and stuff, but there's just as much interest outside of that in health plans or in practice groups. So it was a nice question that illustrated a number of things. So Sherry?
Great, thanks to both of you. Could you advance the slide one more, and we'll talk about the objective number 2. So objective number 2 is we've recommended some tactics for promoting the PCMH as part of government healthcare programs, and there are 3 options here that ideas we came up with at the leadership retreat. Develop messages around the impact of strong primary care infrastructure on healthy system performance. Create advocacy tool or resource on best practices and models to influence state health programs. So really trying to help those state programs without obviously doing their jobs, because they know much better what needs to happen within their own states. But if we could create some tools and resources and identify best practices for them, we think that would hopefully be helpful. And we want to support advocacy and create a framework for model state health policies. Those are 3 ideas that we've talked about at the leadership retreat that sort of rose to the top, and so we're interested in your feedback on those. And So we'll be conducting another poll across these to see which ones rise to the top, or perhaps they'll all end up being determined as important. But we'd like to get your feedback. So I'm going to turn it back over to Greg for polling.
Okay, so we're going to be looking now at this set of objectives. And again, I'm going to read them, and I would hope that you can vote on them as I'm reading them. And I'm also hoping that this will trigger off a bit of discussion around focusing on state programs as well as the usual federal programs of Medicare, Medicaid, and the exchanges, which sort of cross the bridge between state and federal focus. So the first is to develop messages about the impact of strong primary care infrastructure on system performance or health system performance. The second is create an advocacy tool and resources on best practices and models to influence state health programs. And finally, support advocacy and create framework for model state health policy programs. So if you can vote on those. And the other is also an option. And again, I hope this sort of sets off a little bit of discussion in this area with the group.
And as oh, never mind, I'll let Greg keep going. I was just going to highlight what he said, is that this is an advocacy and public policy center. And while a lot of our work will be focused on the federal level, we're very interested in figuring out the ways we can most effectively help the states in these efforts as well. So with that, I'll turn it back to Greg.
Okay, so you can see that the biggest thing, again, and this sort of is a carryover in some ways from our first set of objectives, and that is really develop messages. And I think that what the message should be and what format it should be in, we might want to touch on in the discussion that's going to follow this. And then create this framework for model state health policies, because as I think you know, I suspect living in a lot of different states around the country, there's really a beehive of activity in this area right now, whether it's related to the exchanges, the Medicaid expansion, or just other state efforts related to trying to squeeze more value out of the healthcare system. So with that, let's open it up for comments and questions, especially the person that voted other, or the persons that voted other. We'd like to hear what that was. So don't leave me hanging here, somebody.
Melissa Moorhead, you're now unmuted.
Hi, thanks. I voted other because I was going to choose develop messages on impact of PCMH on health system performance, but really I think the highest priority is to examine data on that performance before we start developing messages. I think that's what I could use most of all in terms of making any impact on policy or adoption of PCMH, is to first get some really good longitudinal data on the impact this is having, not just on health system performance, but the entire triple aim, including cost savings and individual health.
Okay, could you share with us who you are?
I work for Michigan Public Health Institute
great.
in Michigan.
Thank you. Marcy, you want to say something about that? Because again, that was a major issue or area for the evaluation research group. So again, a nice illustration of how these centers are hopefully going to work across different areas.
Right. Well, so developing messages on impact of PCMH on health system performance, I think, is my number 2. But since it only addresses health system performance, and I'm also very interested in data regarding the impact PCMH has on the entire triple aim, which includes cost avoidance and individual health and population health, is very important before we develop messages to make sure that they're very data driven. Would be the my biggest need.
Okay, Marcy, you want to comment on that?
You bet. Thanks, Greg. So couldn't agree more. And of course, if you are developing messages without utilizing data that's that's based on the evidence, your message is going to fall on deaf ears because you're just using anecdotes. We think the stories are important, and we want to be collecting those stories and sharing them, but it's clear that in the evolution of the PCMH, we're still fairly early in its evolution. We are collecting data through the evaluation process, and Melinda Abrams is one of the two co-chairs for the Outcomes and Evaluation Center. So to Greg's point, if you think about a hub and spokes and how the work of the centers interdigitates, that's exactly the role that the Outcome and Evaluation Center will be playing, gathering that data, helping us think about the best way to share the data in user-friendly terms. And the challenge we have in academia is we gather the data, we use terms about data that don't really resonate with the public and that the media often misunderstand. What we want to do is convert that data into meaningful language and then use the many gifted folks who are working in the Advocacy and Public Policy Center, use their knowledge, their expertise, their relationships, their contacts to disseminate that information. So I'd say Advocacy and Public Policy is the place where the dissemination happens, and of course we'd have to all work closely together because that's going to be a feedback loop between the centers.
And I would just add that from my former perch within the Blue Cross Blue Shield Association, so much of this information is in the, quote, gray literature, or perhaps even deeper in private sector silos. And we really need to, from the public policy advocacy group, push on our colleagues who are actuaries or others in our organizations to really share some of this data and get it out, because there's so much exciting stuff going on, whether you're talking about the Blues or Humana or United or Aetna and others. There's a lot of activity in the private sector, and yet it isn't as available as it really needs to be if we're really going to make an impact and get past the tipping point on the medical home activity. So it's a sort of you can tell it's a passion of mine to try to get that stuff out and in the public thing, and in, as Marcy pointed out, digestible format. So thanks very much for that comment.
This is Sherry, Greg, and I just wanted to add on just one other thing to that, and that is one of the things that I think most folks who have been involved with the PCPCC over a long period of time will find is that you will see a whole lot more cross-center work going on. And that's because we've got a lot more mechanisms in place at this point to facilitate that, and staffing being one of them. And so there are, in the way they've structured the organization a little differently now to facilitate that, and we have some liaisons that work across the centers and with the board. So I am finding, as somebody who's a long time in PCPCC involved person, that it's remarkable to me the way the restructuring has facilitated this type of cross-center interaction. So I think we should all be encouraged that will be going on probably much more robustly than we've seen it going on in the past.
Yeah. Here. There's a lot of stuff going on between calls.
Right, there is, yes. And then I wanted to raise, there was another question on that was typed in from Karen Sanders, and I don't know if she's raised her hand to speak verbally, but if not, I'd love to raise the question that she brought up.
So go ahead.
She mentioned that state programs have a significant percentage of persons with mental health illness and would suggest addressing behavioral health as an objective for the state. So I know there's been work going on within the PCPCC related to behavioral health, and wanted to see if Marcy could comment on that.
Sure. So the behavioral health task force has been ongoing for some time, and the amount of energy and motivation and resources that are shared within that task force is very impressive. When we have our new website locked and loaded, we will have a better home for the Behavioral Health Task Force, which is evolving into a special interest group. But that group continues to regularly meet and share resources. One of the concerns that I had, however, when I got here was that they were siloed away from everyone else, as other parts of our organization were. And I so appreciate Sherry's comments about the way in which the newly reorganized PCTCC is really needing to integrate across centers and across topics. I mean, in many ways, we need to be modeling what integration looks like, and we actually modeled the fee-for-service world because we had so much going on, and folks were kind of stuck in their own silos. So on the behavioral health front, I strongly encourage folks in that space to get integrated into each of the centers themselves, which I think they've done a fabulous job of dividing and conquering. And I know our friends at the American Psychological Association, who are members of the executive committee, are on all of the other centers, and are highlighting the need for the integration of behavioral health when you're talking not only in the care delivery and integration center, but also with the employer and purchasers. What role does behavioral health play in that space, et cetera, et cetera. So I would say that the role of behavioral health is elevated in this new organizational structure because it is being integrated into each of the structures. But we still wanted to create a special place where that dialogue across behavioral health providers and organizations could still occur, and that will occur in the special interest group work that is still ongoing.
Thanks, Marcy. I noticed that Tara also provided for everyone a link in the chat section of the webinar to the behavioral health work that's been going on. So you can access it there either now or right after the webinar. We don't want you to go away right now, though, because we do want you to answer our next polling question when we get to it. Go ahead, Greg.
No, Sherry.
Oh, my turn. Is it my turn?
Yep.
Okay. So we're going to move on to the next slide, which is our final objective that we wanted to get your feedback on. And that is recommended tactics for gathering data. And this has already come up already, obviously, in our conversation to date. And so the tactics that we've proposed or that rose up through the leadership retreat discussions were to develop advocacy and communication tools to advise states on best practices for designing medical home-friendly health programs. Things like within the exchanges to ensure that they're medical home friendly in terms of the benefits that are built into those exchanges. Medicaid payment reform and ACOs. One of the other ideas was to create talking points and establish communications plan for defending against medical home critics. Obviously, strongly based on the evidence. We want to be sure we respect any research that may be done that comes out on any side of this issue, but we want to be sure that research that we see that may be critical is really strongly based on evidence, and that our responses are based on evidence as well. So we want to just keep an eye out for those things and be mindful of them and respond to them in a meaningful and fast and timely way. One of the other ideas was to identify medical home recognition hotspots and factors that influence those trends. So what areas of the country are there a lot of practices that are recognized by any one of the accreditation entities that are involved in this recognition process? NCQA, Joint Commission, AAAHC, I think is, and URAC are the primary ones, and I certainly don't intend to miss anybody, so you should feel free to speak up during the Q&A if I did. But so we want to look across all those programs. We're not looking at any one over any other, certainly, and identify hotspots and those factors. Are there a lot of payers that have gathered together to influence that? I think that'll be helpful. That could be helpful moving forward in terms of how we help facilitate the spread of this in the future. And then we want to improve communication with private and public sector actuaries who are looking at cost savings. They often have approaches that are maybe a little different from some of the health service research that's going on. And so we want to be sure that we have regular communication with the actuaries and understand their approaches and be sure that we can help spread the word, too, about cost savings that they that they might determine exist within the medical home programs across the country. So those are some of the tactics that we came up with. Again, we're looking for your feedback on prioritization around these tactics. And with that, I'll turn it back over to Greg for polling.
Okay, so we can go to the next PowerPoint, which should be the next one should be the polling. And here we are. And again, it's sort of truncated, so as I'm reading these, I hope you will be voting on them. Remember, this is tactics to deal with Objective 3, which is gather and communicate evidence that demonstrates medical homes have an impact on the triple aim, better health, better care, and lower costs. So the first is develop advocacy and communication tools to advise states on best practices for designing medical home-friendly health programs. The next is create talking points and establish communications plan for defending medical home against critics. And I just finished rereading the recent article that did just that. The next is identify medical home recognition hotspots and factors that influence those trends. And I would add that should also probably include public sector programs, because obviously the major program that CMMI has going now is I think, beginning to have an impact. And finally, improve communication with private and public sector actuaries to demonstrate cost savings, and that echoes my impassioned plea in the last segment. So if you'll vote, we can see the results.
And while we're looking for the results, one of the things that if Marcy or Tara could provide a link to, I think, is that article that Greg was mentioning, because it was a very good article that you all wrote in response to a recent publication.
Okay, so I think I may have unduly influenced this, and if so, I apologize. But I really do think it's an important area, and you can see, I think creating the tools that are really going to help states is another major area. So with that, why don't we open up the discussion on this area, and it especially would be helpful if there are some ideas out there about how we might be able to get more data out of, quote, gray literature. Because, I mean, one of the real problems with the article that critiqued the medical home was the data was 2 or 3 years old. It was based on mostly, the usual randomized attempt to find randomized controlled trials and stuff, which is, as a health services researcher, I love that stuff. But it's really not, I don't think, what's changing public opinion or the public and private decision maker opinion right now. It's these other things that are causing, CEOs to make, I think, very major decisions in this area. So with that, let's open it up and see if there's some ideas or comments out there.
David, would you like to, I'm not sure when you raised your hand, but would you like to make a comment? David Pollack?
Sure. Yeah, can you hear me?
Yes.
Yeah.
Hello? I wrote a comment, but I would just say that the states, many of the states may have mechanisms within them where they are already tracking data from primary care homes. Mm-hmm. I'm in Oregon. We have over 300 registered primary care homes at this point that have had to submit data on what attributes they have and how they meet the measures that we develop for defining a primary care home, and that funding and compensation is tied to the level of primary care home sophistication they have, and our system is involved with tracking outcomes as well. So the State Office of Health Policy and Research has this great body of data that they're accumulating, and I would assume at least some other states that are also on the vanguard of health reform, especially in this area, are doing the same thing. It'd be nice to consolidate those or try to knit them together either through the National Governors Association or one of the other groups that monitors health on all the state levels.
Great suggestion, and one that not only we need to look at, but also the outcomes and evaluation. It's interesting because I think this whole area is a huge challenge to researchers or people that do outcome studies, because it's not their usual or traditional sources of data. So that's a great suggestion. Others?
Yep. Lauren Agaratis, you are now unmuted. Can we hear you?
Yes. Hi, Lauren Agaratis, Family Voices, New Jersey. One of the things that we have found is effective in our testimony and comments on the patient-centered medical home and healthcare reform is stressing evidence-based best practices and kind of proving the cost savings and the better health outcomes. I think that's where you're going to get buy-in. I think that the legislators and the professionals need to know, hey, what's in it for me? So those are the tactics that we use.
Thanks. I think that brings up another really key point about all the activity within our center and across others, and that is, we talk about sort of the best evidence about the medical home. I think we also ought to be sharing as much as possible the best practices and best messages that seem to be working, because each of your organizations is out there, I think, stumping on this stuff, trying to develop evidence-based messages and stuff, but also in different formats and different ways. And some of you have had fantastic successes. I do think there's hotspots all over the country now where literally it's into the hundreds or even thousands in some states of practices that are now fully involved in the overall process of becoming, and I don't think you ever become a medical home, but are on the trail of practice improvement that is sort of the backbone of BCMH. So great suggestion. But I think it also maybe is a little project that we ought to be thinking about is how do we share these best practices? How do we, in terms of what the messages are and how they resonate with different audiences? Because we still have a lot of work to do in this area. Any others? I think at this point we're getting close to the end. If there's any sort of overarching comments that anybody wants to make, and also we really appreciate your feedback on how this did or didn't work, how we could improve it going forward. So please do drop us an email or a note. And again, if there's any sort of overarching comment point, let's do it.
Greg, it looks like we might have one final poll as well. It looks they might have pulled all the top picks from the other questions for one more poll.
Okay, are we ready to do that?
Oh, look, it's up. You're moving.
This is where you really inspire staff.
I know, it's wonderful.
So here's the final one to vote on, and these are the ones that you identified as number one from the polls that we did already. So as you can see, the first is develop publication on PCMH value and ROI, communicate cost and quality data to policymakers, develop messages on the impact of the PCMH, create a framework for model state programs, and improve communication with actuaries. So can you vote on that? We'll give it that, and then we'll wrap it up. All right, so communicate cost and quality data to policymakers and the public comes off as the top priority, and then creating the framework for state health policies on the PCMH is number two, but I think there's some support for each of them. So thank you so much for joining us and hanging in there. I'm an ADD person, and I have a lot of trouble hanging on webcasts and stuff, so I firsthand know the issues and the temptations to multitask. So thanks so much for joining us. There is a short post-webinar survey that you can get via email shortly, and we really would appreciate your feedback because this is the first in what we hope would be a series of these going forward. And feel free to get in touch with Tara Hacker, who's the Director of Programs at the PCC, about any feedback, or obviously Sherry and I would be more than glad to hear about this. But Tara's information is popped up on the final screen. So thank you all. And Marcy, I don't know whether you have any final word in the last minute, but from my standpoint, and I'm sure from Sherry's, thanks so much for being on here.
Yeah, this is Sherry. I agree. It was very helpful. I'm going to let Marcy talk now.
My thanks to both Sherry and Greg. So appreciate their leadership, and a big thanks to Tara and to Lauren and to Michelle for being the fabulous staff that put together today's presentation. So happy Valentine's Day, everybody. Go out and eat chocolate and kiss people. Thank you.